Hi everyone, my name is Elke Durso, and for this presentation I will be discussing acute pain and examining a new potential drug treatment called suzetrigine. Before I talk about this new drug, I would like to review some common concepts regarding acute pain. Acute pain is defined as intense pain that is usually temporary and resolves after healing or treatment. It commonly occurs due to tissue damage and activation of peripheral pain receptors. This type of pain is considered beneficial because it is a warning signal and protective mechanism alerting the body to a potential injury. This allows for prevention of further injury and promotion of healing. There are many different causes for acute pain. This can include physical injuries such as bone fractures, burns, cuts, or muscle tears. Many surgical procedures result in post-operative acute pain as well, especially surgeries involving large incisions, organ removal, amputations, or surgeries that specifically involve bone. Other medical conditions like infections, heart attack, headaches, or even kidney stones can also be sources of acute pain. There are many signs and symptoms that are indicative of acute pain. For example, acute pain develops suddenly with sharp throbbing or burning sensation that can cause discomfort. It is usually localized at the injury site, showing signs of redness, swelling, and tenderness. Acute pain also results in body responses of the sympathetic nervous system, such as elevated heart rate, elevated blood pressure, sweating, reduced appetite, restlessness, and muscle tension. When it comes to mechanisms of acute pain, a trauma to the body is what leads to the activation of nociceptors, or pain receptors, at the site of injury. Nociceptors are sensory neurons that detect noxious stimuli or stimuli that elicits a pain response. They respond to thermal, mechanical, or chemical stimuli such as intense heat or pressure. Now, there are different types of pain mechanisms that can result in chronic or acute pain. The mechanism I just described is called nociceptive pain and is caused by tissue damage. This is often seen in acute and chronic pain. Neuropathic pain is caused by nerve damage and is commonly seen in chronic pain, but can also be present in acute pain as well. Pain processing occurs when noxious stimuli, or as I mentioned before, stimuli that elicits a pain response, comes into contact with tissue, which is then detected by nociceptors and triggers the release of pain signals. This is called transduction and is illustrated in the diagram on the presentation slide. These signals then travel from peripheral nerves to the spinal cord and brain in a process called transmission. Modulation occurs when these signals are altered or changed by the nervous system to enhance or inhibit the signal responses. These signals are interpreted by the brain, resulting in conscious awareness of pain, also known as perception. Pain perception can vary depending on mental state, past pain experience, and many other factors. Distraction and cognitive control can lower perception, while anxiety can increase it. Current treatment for acute pain varies depending on the patient and the severity and location of the pain. The first step in treatment, especially for mild to moderate acute pain, is administering non-opioid analgesics, such as acetaminophen or non-steroidal anti-inflammatory drugs. Acetaminophen is a commonly used and favorable treatment for acute pain. However, it does lack anti-inflammatory properties, and there is a risk of liver toxicity at high dosages. Non-steroidal anti-inflammatory drugs, specifically oral non-steroidal anti-inflammatory drugs, can be more effective than acetaminophen for certain acute pain symptoms with inflammation. Some examples of non-steroidal anti-inflammatory drugs include ibuprofen and naproxen. Despite these positive qualities, there is GI, liver, and cardiovascular risk when taking high dosages, similar to acetaminophen. Opioids are administered for cases of severe acute pain, often used for short periods of time to lower risk of dependence and side effects. This also involves close monitoring and patient education on risk of addiction. Opioids can also be used alongside non-opioids to lower the amount of use and thus lessen the risk of adverse effects. This is commonly more effective than treatment with just opioids. Some well-known opioids include morphine, fentanyl, and codeine. For a while, there was minimal progress in research for finding better treatment options to replace opioid drugs in managing acute pain. Opioids can have many negative side effects and high risk of addiction, which is why it's so important to find safer and more effective alternatives for treating acute pain. Suzetrigine is a non-opioid drug that was recently approved by the FDA for the treatment of acute pain. It is an inhibitor of the voltage-gated sodium channel 1.8, which is expressed in the peripheral pain neurons. It is the first inhibitor of this sodium channel to be approved for acute pain treatment. When looking at the mechanisms of suzetrigine, it acts as an allosteric modulator, binding to a specific site on the sodium channel 1.8. This stabilizes the sodium channel to its non-conductive state, preventing sodium influx. This in turn inhibits pain signaling. Its ability to selectively inhibit the sodium channel makes it a promising new treatment for acute pain. And studies indicate it is highly selective without targeting other sodium channels. It is also indicated that long-term repeat doses, even at dosages much higher than normal, show no signs of side effects, no signs of central nervous system side effects, or cardiovascular health side effects. In several clinical trials, there is little to no evidence of addictive potential as well. This drug approval was the first step in finding safer and effective alternatives to opioids for pain management. It has only been studied and cleared for acute pain. However, I would love to see what future studies on its effects on chronic pain may show for future treatment. And that's all for my presentation. Thank you for listening and reading along. I hope you enjoyed. I had fun learning about this new drug. There's really not too much on it. It is brand new, but it's exciting. The first drug approved in the past decade, I believe. So yeah, thanks for watching.